a naturopathic doctor, and I have a practice here in Denver that focuses on autoimmune diseases. And this is something that I really enjoy talking about, so I'm grateful and happy to have this opportunity to speak with all of you today. Really, I could talk about this for hours, and it was hard for me to get a presentation into just 50 minutes. And in fact, what I initially set up was a little bit long, so we're going to skip some of the slides that I had initially set up to do. I practiced it last night, and I was going at a really fast speed, and it still took me about an hour. So I had to adjust just a little bit here. First, I want to check in. Are you guys getting any feedback, or does the microphone sound good? Okay, it sounds good. It's really echoey for me, so it's kind of strange being up here. Okay, so here's what we're going to cover today. First, I want to familiarize all of you with what a naturopath is, because this is something that when I tell people I'm a naturopathic doctor, they usually meet that with interest, but not really knowing quite what it is or quite what qualifies me to treat people. Then I want to talk about, during most of the presentation, how I approach autoimmune diseases, understanding them, and helping people to heal from them. And this is a multi-system and individualized approach. So to understand that, I was originally going to cover 3 concepts, but I had to truncate it to 2. So I'm going to talk about this concept of therapeutic order and what I call bringing in the light, which sounds very woo-woo, but it's actually a very logical, simple concept that helps us understand how we can approach diseases if we don't know an exact cause of the disease or one thing that's going to cure it. We're going to skip the roadmap of what treatment looks like, but through some of the case examples that I'm going to use, you'll get an idea of that. And then we're going to look at one specific area that I find needs to be addressed in all autoimmune diseases, pretty much across the board. So my goal is to really inspire you to reach for a high level of wellness despite a diagnosis of Scleroderma. And also, I want you to understand that there are lots of ways to get at healing and wellness in the body. So we don't have to look for just one cure. We can foster healing in many different ways. So the first thing I want to talk about is what is a naturopathic doctor. So again, when people hear that, I can tell from questions that they're kind of trying to feel out if I actually practice medicine and what I do. I often get the question of, how long was your program? Because I think people want to feel out, like, did you take an online herbal course? Are you a health coach? What exactly are you doing? So one thing that I find helpful to share is what our training is. And so that's what this chart shows. So this is comparing, on the left side, you have 2 of the main accredited naturopathic colleges in the US, and the one on the far left is the one that I went to. And then there are 3 major medical universities for conventional medicine, and then 2 programs for natural medicine that aren't accredited. And so this is looking at, when we go to naturopathic school, we have to have the same background that medical doctors do to go to medical school, because we're going to be practicing medicine, so we have to take chemistry and biology and have that background. And then we also spend a lot of time learning the basic and clinical sciences, and we do clerkships as well, and we learn about allopathic medicine or conventional medicine too. But we also learn naturopathic therapeutics, and so this is going to be things like botanical medicine, supplements, homeopathy, physical adjustments for the body, and we spend quite a bit of time learning therapeutic nutrition as well. And you can see that our total number of hours are actually pretty similar to conventional doctors and how much goes into our training. So we're very well trained. And many people think that the biggest difference between a medical doctor and a naturopathic doctor are simply the therapies that we use. The big difference is that instead of using pharmaceuticals, we use vitamins or we use herbs to kind of intervene at the same place. But that's not actually the biggest difference between us. We have really a different approach to health and disease in the body, and we tend to intervene at different levels. And so to illustrate that, we can look at what's called the naturopathic therapeutic order. So this is simply a diagram that shows kind of a hierarchy of healing, not necessarily a hierarchy in the sense of one level or part of it being better than the others, but just showing all the different areas that we can intervene when we've been diagnosed with an illness or we want to create healing in the body. So we have on the bottom these foundations for health. And these are really simple things like making sure that we have proper nutrition and clean air, and we have movement, and even things that we realize are increasingly important for health, like building community and taking time for creativity, things like removing environmental toxins. So those are the foundations. And then we have stimulating the body's natural ability to heal. So this is another concept unique to naturopathic medicine, that we find that if we remove roadblocks or things that are keeping the body from functioning naturally, and we provide the body with the right environment and the right information, it naturally wants to heal. So we want to foster and stimulate that process. Then we try and identify specific organ systems and tissues in the body that need support, and to support those. We also want to make sure that the right structural alignment is in the body. And then the top of this pyramid is about controlling symptoms, either through botanical medicine and herbs, or pharmaceutical medicine and surgery and things like this. When people get diagnosed with a disease, or we have a symptom, and that doesn't have to necessarily mean like a Scleroderma type symptom, this could be something like insomnia or a skin rash or your hair falling out or any kind of symptom, what we tend to think about first are the three things on the top of this pyramid, right? I'm sure all of you have spent time researching Scleroderma online and looking for, what you can take, whether that's a pharmaceutical or something natural, to stop the symptoms. So we automatically think about these top three things. And probably some of you were hoping that having a naturopath here today, I might present different substances that you could use to control symptoms. And indeed, I could have come up with a lecture talking about things like vitamin E and vitamin D, evening primrose oil, and N-acetylcysteine, because these are all natural substances that have been studied for Scleroderma. And they've shown some promise, but really, that's not what I do, and that's not what I find most interesting or most effective in my practice. So at this point, I should really let you in on a little secret. I don't actually treat Scleroderma, and I only sort of treat autoimmune diseases. And that might seem strange that I'm here talking to you if I don't treat Scleroderma, but I'm here because I treat people who have been diagnosed with Scleroderma, and I treat people who have been diagnosed with autoimmune diseases. And here's what I mean by that. So when we're dealing with these top three levels of this therapeutic order, we're dealing with the disease. So that can either be through treating the symptoms, again, with natural substances or with pharmaceuticals. But what I really do is I work with these bottom four levels and treat the individual that has that disease. And I find this to be very much more effective than just trying to give you herbs or supplements to deal with the symptoms. So when I do this, when I treat with these bottom four levels, I tend to find at least 2 of 3 things happening. The first thing that I find is that as we work on these bottom 4 levels, I find that often the need for intervention on that second or those top 3 levels can be much smaller. And sometimes we don't need to intervene with surgery or pharmaceuticals or specific natural therapies to get rid of symptoms. So we can alleviate the need to treat up there. So that's one of the reasons. The second reason is that if we can't alleviate the need, by working on those bottom 4 levels, we often find that the top 3 levels work better. So the pharmaceuticals may work better, your surgery may be more successful, things like this. And I'll give an illustration of that in just a minute. So what I'm really focused on are those bottom 3 things. So to look at this from a slightly different way, I realize some of you I spoke to last spring, so we kind of went through this already, but we do need to hear things 7 times usually to have them really sink in, so just bear with me. Okay, so if you all will take a moment and play a little game with me and imagine that we're in a completely dark room. And we want to make this room light again. We want to see what's in it. I'd love to hear some ideas about how you would light up that room. And you can choose to do anything that is within normal human capability to light up this room. What's that?
Open a curtain.
Open a curtain. Great. What else?
Turn on a flashlight.
Great. Turn on a flashlight. What's that?
Close your eyes.
Close your eyes. That's going to keep it dark. Oh, open your eyes. Okay. Great. What else?
Call an electrician.
You could call an electrician. That's true. Yep, you could flip a switch. You could use a candle. We could turn on a cell phone, as somebody said last time, which was great. So we could do those things. We could put up a chandelier. We could put in a skylight. And once we do all that, we're eventually going to have this, which is a fully illuminated room. So if we think of disease as that dark room, we can't just suck that dark out, right? Instead, one way of getting rid of that dark is to build up the light through a number of different sources. So I like this analogy or illustration because I think, again, it shows that if we can come at a disease from multiple angles and we can just build health, then it really doesn't matter what that disease is or whether we have a specific cause or a specific cure. Because if we can build health, it can crowd out disease in the body. Does that make sense to everybody? Okay. So I'm going to share a case to illustrate sort of how this works. And I'm going to go back to, oops, that was the wrong direction. I'm going to go back to this so I can talk about how treating these bottom 4 levels and bringing that light in can alleviate the need to treat the top 3 levels. In this case, it's not a scleroderma case, but it is an autoimmune case. And it's one that has to do with autoimmune thyroid disease. And it doesn't matter that it's not scleroderma because, again, we're not treating the disease, we're treating individuals and somewhat autoimmune diseases. And I bet it's relevant to some of you in here because thyroid disease is so prevalent, right? And many of you probably have that as well as scleroderma. So about 17 months ago, I started treating a young woman, 30 years old when we started working together, and she had been diagnosed 2 years prior with Hashimoto's disease, which is autoimmune hypothyroid, so underfunctioning thyroid. And at the time that she was diagnosed with this, she was asymptomatic. So they had just run screening blood work on her and found out that her thyroid was off, ran antibodies, found out that they were positive. So the first thing she tried was something called a high-dose iodine therapy, which is something that some natural doctors use, and it made her feel pretty horrible. So she ended up going on synthetic thyroid medication, and it brought her thyroid markers, so the TSH, which is your brain talking to your thyroid, it brought that into normal levels. And that's what's generally looked at when an endocrinologist is treating Hashimoto's. So it's considered pretty successful if the TSH is in a normal range. So she came to see me, and she was still somewhat asymptomatic, you could say, for thyroid disease, which is not always the case with patients that I see. Except that she and her husband had been trying for the last year to get pregnant. And when a 30-year-old isn't able to get pregnant after a year, I do think about that as infertility and often having a thyroid or an autoimmune origin in it. So there was that little bit suggesting that an autoimmune disease was still there and a thyroid issue was still there. But when I first spend time with a patient, I'm not just asking about symptoms of that disease. I ask about all kinds of other parameters of health. Because, again, I'm focusing on how to treat that individual, and I want to know all the places that we need to intervene in these bottom 4 areas. So what I found out from talking to her was that she had some other symptoms going on in her body. So first of all, she had some anal fissures. So about 3 or 4 days every week, she bled when she had bowel movements. And it wasn't major bleeding. She'd never been treated for this. She had talked about it with her primary care, but they hadn't done any treatment. She also had athlete's foot and toenail fungus for a few years. Her menstrual cycles had some bloating and cramping with them, which so many women say it's, just a part of having a menstrual cycle is that normal bloating and cramping. She had no appetite. She ate, she enjoyed eating, but she never really felt hungry for meals, and she would skip meals or multiple meals during the day with no problem. She also didn't sweat, which I was paying a lot of attention to because sweating is a normal way of the body to eliminate, get rid of toxins, and regulate temperature in the body. And then she also had chronic postnasal drip. And the last thing that we talked about was she was being treated for increased pressure behind her eyes. And this is something she had felt since she was about 14, but she had always thought it was from sinus troubles. And it turned out that about a year earlier, she had been diagnosed by an ophthalmologist who said, no, this is actually due to the structure of your eyes creating increased pressure. So she was taking drops to control that, but she still experienced bouts of increased pressure on and off throughout the day. So it was better, but it was still kind of an issue. So these are all the things she presented me with. We did some blood work on her, and I found out that, like many people with autoimmune diseases, she had markers of other autoimmune processes happening in her body. So she also had a positive rheumatoid factor. She didn't have any musculoskeletal symptoms, but she had that positive antibody, and she was also positive for celiac antibodies. So even though she had been diagnosed with an autoimmune disease 2 years earlier, her immune system had never been treated, so she was also developing other autoimmune processes in her body, which is really common to have happen, as I'm sure many of you know. She also had some other positive markers of inflammation, and things like her cortisol, which is a stress marker in her body, was way too high, and her body was making her thyroid backwards. So all kinds of interesting things to look at. So one way of approaching this would be to say, let's give you a suppository made of herbs and some cream for the fissures. Let's give you something called cramp bark for your cramps during your cycle. Let's give you some tea tree oil to try and get rid of the athlete's foot, because those are all considered natural therapies. If you sat down and Googled those symptoms, those would definitely come up. But that would really be treating that third level there, right? That would really be treating all the diseases and not actually the individual. So instead, what we did with her over the course of the next 16 months is we worked on those bottom 4 levels. And really, for me, it's the bottom 3 levels. I usually refer out for any kind of structural issues for people. So the first thing we did was we established some foundations for her. And I also wanted to start with a specific organ system. So every time I meet somebody, I'm assessing what organs do we need to address. And usually it's going to be multiple systems over time when there's an autoimmune disease or other complex chronic disease. So with her, the digestive system seemed like an obvious place to start for several reasons. Of course, we have the anal fissures, which are obviously part of the digestive system. And I also considered her lack of appetite to be a symptom that something was wrong with her digestive system, because a normal, healthy appetite is a sign of health in the body. And then whenever somebody has an autoimmune disease, I'm going to think about their gut and their digestive process. And that is a part that we're going to focus on later on, and you'll understand a little bit more why. So we started focusing in those areas, and the first things we saw shift, I forgot to mention she had a bunch of skin rashes as well that would just pop up in really sensitive skin. Those went away. She developed an appetite. She started sweating. And then her periods became a non-event for her. So no cramping, no bloating. So I never addressed her menses specifically, and yet that cleared up. I never addressed her skin specifically, but that cleared up because we worked on these bottom areas. 15 months later, her athlete's foot is gone, and her toenail fungus is 90% gone, which is kind of amazing because we never did anything topical or antifungal at all with her. But because we treated these bottom levels, we alleviated the need to do specific therapies. Does that make sense? So we started to see all of these changes, and with autoimmune patients, I like to follow the markers of autoimmunity in their body, which is not something that's necessarily typically done. But her antibodies for Hashimoto's went down to at least a fifth of what they were in the beginning. So simply by treating those bottom levels, we were able to treat multiple diseases and symptoms in her body. Does that make sense? Okay, I'm going to assume that it does. So my focus is really in these bottom areas with people. All right, I'm going to skip that and go to here. So, I said we would all like to find these substances that we can take to make our disease go away. We get really focused on finding the cure for a disease. And the idea of finding a cure points to the idea that perhaps there's one cause to a disease. And I find that to really simply not be true. If it were true, we'd probably have the solution for what causes scleroderma right now. We'd probably have an idea of what causes all autoimmune diseases if it were as simple as one cause leads to a disease. And so going on that logic, I don't think we're ever going to find a cure for the various autoimmune diseases and chronic diseases that we have. And by not finding a cure, I mean, I don't think we're ever going to find one substance, whether that's this amazing drug found in the Amazon or something else, but we can find solutions for it. So typically on that first appointment, when I'm talking with people, I always ask them what was happening when the symptoms of your disease started. What was happening that month, in the last 6 months, in the last year. And often people can pinpoint one thing that was really off in their life. I would say most commonly, it's some source of increased stress happened at that time. So in our minds, it might be easy to say stress caused our disease. But what I find is that that's usually not true. Usually we've had multiple challenges to our body that create the conditions for an autoimmune disease to develop. So I like to share these two images with patients when I work with them and with people when I'm giving talks. So this one on the left is a scheme that's showing all the major organ systems in the body. So on this scheme, all these organ systems have a relationship to each other. You can see that the digestive tract has a relationship to the lungs and the kidney because they're on the same triangle. And it has a relationship to the nervous system and the cardiovascular system because they're next door neighbors. And it has this across the scheme relationship with the endocrine system. So when one of these systems gets challenged by any sort of stress, that could be an emotional stress, it could be an infection, it could be a toxin, it could be any number of things that put a challenge to that organ system, and it gets out of balance, the rest of your body is going to shift to compensate for it. And this compensation is a really awesome thing because it keeps you from experiencing symptoms every time you have a challenge to your body. And that's really important because it allows us to go through life without reacting all the time. But what it also means is by the time we develop a disease and we have symptoms, there's been a lot of shifting and compensating in all of these relationships. So what I find with complex chronic diseases, scleroderma and all autoimmune diseases being part of that category, is that we can't intervene at just one place. We have to intervene and support multiple organ systems in the body. And that's not just the organ systems that you're experiencing symptoms in. So it's not just the skin and the musculoskeletal system where you can experience a lot of symptoms of scleroderma, and it's not just the immune system. So a patient example that I like to use for this is a young woman that I treated maybe 10 years ago for something called interstitial cystitis, which could be part of the kidney system because it impacts your bladder. And it essentially feels like you have a bladder infection all the time, but there's actually no infection. It just feels irritated often. And we tried to do lots of treatment to her bladder to try and soothe it, try and rebuild the walls, things like that. And the results were kind of so-so. But over time, what I realized was that it was actually her digestive system and I'll say her mental, emotional body that needed support in that. So I realized that she was constantly reacting to toxins, specifically chlorinated swimming pools and cleaning the bathrooms. So that told me that her liver needed support because her liver processes toxins. And also, she had a big emotional stress around the time that this started that had actually happened when she was 2 years old, and it was repressed until she was 16 when the interstitial cystitis started. And so by really addressing those areas, we were able to heal the bladder. So sometimes it's not the system that we think it is that needs support. So it's really important that we address all of these. Another way to understand that it's not just one cause and we don't need to intervene at just one level when we have an autoimmune disease is to think about a bucket. And this bucket has lots of capacity to fill up. And if you think about the things that are filling this up as challenges to the body, it's very, very helpful. So this bucket can fill up and fill up and fill up and still have capacity for more and more and more and more until there's one thing that tips it and it spills over. And you can think of that spilling over as the full-blown symptoms of an autoimmune disease. And there have been studies that support this. So there was a study done on patients at the VA, and this was a study of about 300 people. All of these patients had been diagnosed with lupus, and the VA apparently saves blood samples over time. And so they had blood samples for these patients for as far back as 10 years prior. And in those prior blood samples, they'd never been tested for autoimmune markers. But once they were diagnosed with lupus, they retested some of those autoimmune markers, and they found out that the ANA, which is one of the markers that can be positive in lupus, in 88% of the people, it was positive in a previous blood sample. And for some of them, those samples were as old as 10 years old. So that process had been developing for a long time. And I think that's important to know because it points to the fact that this process has been developing in the body for quite a while, and it takes time to heal and fix that process. And I always want my patients to understand that because in my approach, I'm working on different layers of health in the body, and to really get good results, like I did with that patient with Hashimoto's, where we're reversing the autoimmune disease, it takes time to unwind what has happened. And we can be addressing events as far back as 10 years or 20 years earlier in the body. Oh, okay, we're actually going to skip this slide because we don't have time, and that one. But what I want to spend the last sort of 15 minutes talking about is a little more specific and practical. So I said that multiple organ systems in the body need to be addressed, and that there was one that I find needed to be addressed in all of my autoimmune patients, and that's the gut and digestion and nutrition. So some of you were in a breakout session that was about how scleroderma impacts the gut. But what I'm talking about is actually something different. It's going to be about how the gut impacts scleroderma for the most part. So we're coming at it from another direction. What inside the gut, or what about the health of the gut, might be perpetuating symptoms of your autoimmune disease and making it worse or helping to heal it? So why is addressing the gut so important in all people with autoimmune diseases? To start with, it's simply the anatomy of our gut and our immune system. So about 70% of your immune system is located in your gut. It's not technically in your gut, because in your gut is essentially a tube from your mouth to your anus, and everything inside of it is really outside your body, but your immune system is going to be surrounding that tube of your digestive tract. And so this picture here just shows, it's a drawing of your digestive tract, and all those little sort of starfish-shaped and circles and these big patches, conglomerates of them, are representing your immune system. So most of your immune system is found inside your gut, and for your immune system to be healthy, we want to create the right environment, a healthy environment around it. So the gut itself has to be healthy for the immune system to be healthy. And as I'm saying that, it's occurring to me, some of you might think, well, when I developed an autoimmune disease, maybe I didn't have any symptoms of digestive upset. But really, when I think of autoimmune diseases and the gut, the autoimmune disease for me is a symptom that there is something going on in the gut. It's not necessarily going to be a digestive symptom. So this is just, I love histology slides. I think they're so pretty. This is a slide of the tissue in your gut, and all that purple is your immune system in the gut. Okay, so not only is 70% of our immune system in the gut, but we need proper functioning of the gut so that we get the nutrients that we need for our body to function properly and to heal. So if we were really going to simplify what we are, we're kind of a big bag of chemical reactions, essentially. So everything that happens in our body can boil down to a chemical reaction, and all you have to do is open a biochemistry book to know that every single one of those reactions is going to be dependent on vitamins and minerals and having the right amounts of them. So for normal reactions in the body to happen, you have to have proper nutrition. And you have to have a healthy gut to be able to absorb that nutrition. So both what we're eating and the body's ability to absorb it are going to be really important to healing. We need vitamins, minerals, and antioxidants in order to fight and heal inflammation in the body. So I think it was mentioned in the very first presentation talking about research, one of the drugs for healing the skin was one that reduced inflammation. So in every autoimmune disease, inflammation is a huge player. So whatever we can do to ease inflammation in the body is going to be important. And then we also need to be able to repair from that inflammation. So the foods that we eat can either promote or quench inflammation, essentially. So digestion is important in this realm as well. And not only are we a big bag of chemicals, but we're also a big bag of bacteria. So the bacteria in your gut, the number of them far outnumbers the number of cells in your body. So you have more bacteria in you than you do you in you. So the health of this bacteria is super, super important. And the bacteria are actually going to be key players in modulating your immune system. So controlling how well the immune system works. So it's really important that we create a healthy gut in order to foster good bacteria that are going to give your immune system proper information. And things like your stress, your diet, and even how you eat are going to impact the health of your gut and your immune system. So when I have a patient with an autoimmune disease, I have several goals for nutrition and digestion for them. So I want to make sure that we're going to optimize absorption of nutrients and also access to those nutrients. So we have to make sure that you're eating a diet that has all the right nutrients in it. And believe me, the standard American diet does not have enough nutrients to either prevent or heal an autoimmune disease. And in fact, most just sort of pretty healthy diets also don't have enough nutrients in them. We want to eliminate inflammation in the gut, and by eliminating inflammation in the gut, that's going to help eliminate inflammation in the whole body. We want, I see a typo there. We also want to create an environment friendly to good bacteria, and that's going to kind of crowd out bad bacteria or yeasts or parasites or other things that can throw the digestive tract off. I think that's another place where people think, oh, if I had an infection in my gut, I would know it. I would have digestive symptoms. But again, if you have an autoimmune disease, that might be the only symptom that the bacteria in your gut is not right. We want to make sure that the gut has proper motility so that everything from swallowing to having bowel movements works well. And that's because your gut is not just in charge of eliminating the waste from digestion, but it also eliminates toxins that your liver have processed and other waste from the body. And then we also want to make sure that you have a healthy gut lining because we want to protect your immune system from what's inside your gut. And I knew I wouldn't have a chance to go into that today, so I did put the URL for a blog under there where I talk more about the lining of the gut and the infamous leaky gut. Okay, so where to start with this? I always want to start with patients on that bottom level of the pyramid, so I'm going to start with what they're eating and how they're eating. And a therapeutic diet is incredibly important for autoimmune conditions and healing them. My goals with those diets are to remove sources of inflammation, and this could be things that are inflammatory to everybody or things that are inflammatory to just some people. So in the beginning, I like to remove all of those so we can figure out for each unique person what things are inflammatory triggers specifically for them. I also take out common food allergies and sensitivities. When I say food allergies and sensitivities, again, people often think that's going to be something that they're going to experience digestively, but that's not necessarily the case. The Hashimoto's patient that I spoke about earlier, one of her signs was we actually figured out that the increased inflammation that was supposedly structural in nature actually responded to her diet quite well. So by taking inflammatory foods out, she was able to reduce the number of drops that she needed, and she no longer had ups and downs during the day. So those can show up in many different systems in the body. And then we also want to take out foods that damage the gut. So those are going to be things like artificial colors, additives, some things that go under natural flavors. Oils, different kinds of oils can be really damaging. Gluten can be a big one. And then in some people, coffee can be really damaging to the gut lining too. But not everybody, just some people. And also this diet is not just focused on what are we going to take out, but what are we going to put in as well. because again, we want to have enough nutrients for our bodies to heal. So sources of antioxidants, fat-soluble vitamins, minerals, omega-3s, probiotic-rich foods, and foods that support detox as well. I could spend several hours just talking about the dietary component of this for people, but if you go to my website, which is healingrootsclinic.com, you can get a e-guide for this whole diet that goes through it in detail and covers frequently asked questions and resources and things like that. And I really encourage you to do that because it can make a really, really potent difference. So to illustrate that, I'm going to share a case of scleroderma. So a couple years ago, I had a woman come in with scleroderma, and she hadn't been medicated at all. Just looking at her, you could absolutely tell that she had scleroderma that was out of control. So she had a very, very shiny, taut face. The skin on her arms were the same way. She hadn't been able to drive herself to the appointment, and she had to stop working because she was a stylist and she couldn't hold her scissors anymore to work. And she really had very little mobility in her fingers and her wrist as well. And on our first appointment, I gave her this diet, and I gave her about 6 habits that I wanted her to cultivate and do. So I didn't give her any herb or nutrient specific for scleroderma. All I did was the diet and some habits with her. And when she came back 3 weeks later, her face looked pretty darn normal. And in fact, she said her mother and some friends had commented on how much the change was. And she also had a lot of increased flexibility in her wrists and her fingers, which was great, pretty amazing. And at the first appointment, I hadn't even been able to take her blood pressure at her wrist because the skin was too tight, and I was able to do it at that appointment. And so that was largely based on just dietary changes. So if there's nothing else that you do, dietary changes can make a huge impact. Okay. In addition to what you eat, how you eat is really important as well. So in naturopathic medicine, we talk about harnessing the healing power of nature, which sounds, again, like using herbs or some kind of mystical force, but really what we're trying to do is promote normal physiology in the body. So help the body function as well as it possibly can by giving it the right circumstances. And so many of us have become accustomed to really eating on the go and just kind of slamming down food, maybe while we're answering emails or while we're driving to work or things like that, or eating in front of the TV and not really paying attention to what we're eating. And this can really be damaging to the digestive tract. And so if we want the digestive tract to be healthy and to function properly, we need to just foster some very simple habits of what I call food hygiene. So these are super, super simple, but they can have a pretty big impact. So I always tell people to sit down in a calm environment. If you can, get away from your computer at work, separate yourself from your tasks and what you have to do, and sit down and concentrate on your food and chew really, really, really well. So the reason that this is important is because your digestive tract and your nervous system have a really intertwined relationship. So we have 2 parts of our nervous system. We have one part that's called our sympathetic nervous system, our fight, flight, or fright, and we have our parasympathetic, which is also called our rest, digest, and repair. So digest and repair are what we really need to notice there. We spend a lot of time in our sympathetic nervous system. And when we're eating quickly and we're in traffic or we're working or we're having a tense conversation, we're in that sympathetic part of our nervous system. And in order for our digestive tract to function properly, we need to be in that parasympathetic state. So we need to be in a calm place. And the reason that our body does this is because when we're in a sympathetic state, we're supposed to be running from a saber-toothed tiger. And we think that our traffic and our emails are a saber-toothed tiger. So what we want to do is shift you into that rest and digest. So a calm environment, chewing, eating at regular meal times are really important. And I go into a lot more detail. Again, I'm going to put up a blog there for you guys because I knew I wouldn't have time to go into detail. But I do want to share another case example about how helpful this can be. So last December, I had a young woman, maybe about 31 or 32. She'd been diagnosed with scleroderma, RA and Hashimoto's. So again, pretty common to have several diagnoses there. And at the end of her appointment, I said, what would you like to see shift first? Which is something I always ask. What's your priority? Where do you want to focus? And she said, she told me earlier, one of her major complaints was choking when she was eating and some reflux as well. And so I said, great. I really want you to concentrate on these things. I want you to do some apple cider vinegar before your meals to help trigger your pancreas and your stomach and your gallbladder to put out the right digestive juices. And I want you to follow this plan. She came back again about 3 weeks later, and she said, at least 50% better. I'm not having any reflux anymore. I'm only having the choking a few times a week. I'm having a little bit of indigestion. Sometimes I feel a little off after meals. But just with those simple hygiene, she cut way down on those incidences of choking, which I think is pretty incredible from just slowing down and eating differently and taking out some inflammatory foods. So for her, I decided because she was still having a little bit of indigestion and some of that choking, we decided to put her on some enzymes. So enzymes are simply something that your pancreas is normally supposed to produce to help break down food. But when we've been eating a lot of processed foods and we eat on the go a lot, our pancreas tends to get a little worn out, and it can be helpful to supplement those enzymes for a while. So the enzymes, in a way, are really treating sort of that top third of the pyramid, but it's totally okay to treat that top third when you need to control a symptom. Our hope is at some point that she's not going to need them. Okay. So other things that I like to consider with treating the digestive tract, because it's about more than just diet and how we eat. Again, we also want to address the individual needs of patients. So that same patient, I ended up doing something from the top category. We did some testing and we found out that her bacteria was out of balance in her gut and that she had an overgrowth of yeast as well. So my hope is that once we get that treated, it may alleviate the need for the enzymes, which is entirely impossible. So testing can be one thing that we can do to look at the health of the gut. It can tell us if you have enough good bacteria or if you have bad bacteria or yeast or parasites or things like this. And those are all important to treat and fix if you have an autoimmune condition. I might use supplements and herbs to help heal the digestive tract, to make sure that it's, again, has good motility and is eliminating normally, and also to reduce inflammation. I will often use probiotics or prebiotics, which are the food for the good bacteria. I'll either supplement those, or we'll talk about dietary approaches to getting those in. And then I explained just a few minutes ago how important it is for the nervous system to be calm and balanced for us to digest correctly. So sometimes I will just really address that portion before I jump more into the gut. And then there are lots of other tools that we have in our naturopathic kit for treating the digestive system. And so remember, when I'm saying treating the digestive system, I also mean treating the immune system, because so much of your immune system is in the gut. So by addressing the gut and its health, we can get at addressing the immune system as well. Okay, I have 3 minutes left. Okay. And really, that was such a whirlwind tour. I wanted to share some philosophy and an overarching idea of how we can get at autoimmune diseases, and also talk a little bit about how important the health of the gut is. Does anybody have questions? Yes?
On your pyramid in the top third, where you kind of talk about normal, like pharmaceuticals and
Yep.
surgery and research, there's some safeguards built into that where there's like kind of the pharmacist and help with interactions between drugs and like you had your specialties.
Yep.
And that way of thinking with medicine. When we start to integrate, alternate approaches like that, are there other safeguards built in that patients can help rely upon to backstop for dosages, interactions between herbal supplements and pharmaceuticals, things like that?
Yeah. There are different databases online that you can look up herbal interactions, so drug-herb interactions, and that's always an important thing to do. On the whole, I tend to use herbs that aren't going to have a lot of interactions with pharmaceuticals, but even things like WebMD will often have them on them. Yeah, and there's also, I'm blanking on the name of it, but the author is Mitchell Babel Stargrove. Of course, he's a naturopath. And he wrote a book along with some other authors that is really extensive in covering drug-herb interactions. So if you were going to use a lot of herbs, I would recommend that. Yeah, and also if you're working with a naturopath or a functional medicine doctor, they should also know really well the drug-herb interactions. And as far as interactions with the bottom part of the pyramid, I don't worry about those so much because we're just working with optimizing function and physiology. Yes?
Do you ever recommend ketogenic diet for inflammation reduction?
I've not used the ketogenic diet with scleroderma or autoimmune diseases. I've used it in neurological conditions, and I've used it for weight loss, but I've not used it. It would certainly bring down inflammation because you're automatically taking out so many inflammatory foods and ones that damage the gut lining, so it could be helpful. I find it hard for people to maintain.
I've seen people use it for cancer, after
Yeah.
they've had cancer, and also for seizures and that. But it seems like it would help with that inflammation part.
Yes, I think it could as well. Yeah. Any other questions? Yes.
This is an economic question.
Yeah.
With your practice, can it be covered by insurance?
No, I don't bill insurance in my office. I give people super bills that they can submit, but I do accept HSAs and things like FSAs, but it may not be as expensive as you think. So I was kind of curious with that Hashimoto's patient, how much she had spent over time. And so what I did was I added up all her bills for me, and I divided by the number of months, and it came out to be just over $200 a month, which isn't nothing, but it's budgetable for most people. So it may not be as expensive as you think over time. And I didn't run a ton of tests on her. Some people I run tests that are a little more expensive, or I might do more supplementing. So that's not a hard and fast cap, but that just gives you an idea that it may not be as expensive as you think. Yeah, and I personally think for going from like kind of wobbly health to having your autoimmune disease reverse, about $200 a month is pretty reasonable for a couple years. Any other questions? Yes. Yeah. So the one that I use actually is a paleo version. It's an anti-inflammatory paleo diet. And I find that previously, for years, I'd used just a plain anti-inflammatory diet, but I found the paleo was much better at getting dramatic results from the beginning.